More and more people are hearing about peptides and how they might help injuries heal faster and stronger without surgery. In this video, I answer the question from a viewer about a rotator cuff tear and whether a commonly used peptide, BPC 157, would be enough to help that injury heal on its own without surgical repair. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my YouTube channel. The question, just like I said, very simple. I want to take only BPC 157 for my rotator cuff tear. Is it enough to heal the tear? First, a couple disclaimers before I answer. One, this is not medical advice. I am not giving you medical advice in this video, any videos on any of my social media channels or on my website. This is meant for educational and informational purposes only. Also, peptides are considered experimental by the FDA. I am not giving advice on you or encouraging you or pushing you to take peptides. I just know so many people are going online looking for information about peptides, and I want to give at least what I feel is honest and my educated perspective on them. I am not pushing you to do them. If you want to do peptides, talk to your doctor. I strongly advise you to talk to your doctor, potentially get the peptides from your doctor. I've got many other videos on that and other aspects of peptides. But as it pertains to BPC 157 for a rotator cuff tear, I've done other videos on BPC. It's a peptide naturally made in our stomach lining, stomach juices, that has been shown in animal studies to be very effective at getting muscle, tendons, and ligaments to heal. Very limited human data, especially randomized, placebo-controlled human studies on BPC for any orthopedic injury, but it potentially could be helpful. Even in animal studies, to my knowledge, it has not been studied for rotator cuff tears, but potentially could be helpful. Would giving it just by itself as a subcutaneous injection, even if you put it in, say, around the deltoid, be enough to get it to heal? I'd be skeptical of that, quite honestly. And again, we don't have data that shows that it would help. I feel it'd be more effective at decreasing pain, maybe improving function. But if you were to go in 6 months later, would that rotator cuff tear still be there? My educated guess there, and again, it's that just because we don't have studies, my educated guess would be yes, that would still be torn, but maybe be doing a little bit better. As far as regenerative treatments go, I would expect what would be more helpful would either be regenerative treatment like PRP, platelet-rich plasma, where you get blood drawn, the platelets are isolated through a centrifuge and centrifugation to take the platelets out, and then it's re-injected into that area and the growth factors are released. Or what I like even better, autologous exosomes, same process, you get your blood drawn, but in this case, the blood is sent to a lab where they can isolate the exosomes, replicate those, turn them into hundreds of billions of exosomes. It's sent back to your doctor or orthopedic surgeon, and somebody like me injects it into that shoulder around your rotator cuff to get it to heal. And I think autologous exosomes are the next thing past PRP, and I think there's a lot of potential, but this is very early, and even then, those are considered experimental. I'm not necessarily promoting it. But back to the peptides, I do think potentially there's a role for decreasing pain, improving functions, but could it be helpful in addition to a regenerative treatment or in addition to a surgery, maybe to speed recovery, decrease pain, improve strength? Yes, potentially so. That's, again, a very good question to talk to your doctor who is certified in peptides, does peptides a lot, and prescribes them from a licensed, approved compounding pharmacy. Okay, if you have an orthopedic injury, whatever that injury is, rotator cuff tear or otherwise, and you want to hear about options other than surgery or other than cortisone shots, you can click the link in the description below this video and find out more about scheduling an appointment to see me officially as a patient. Also, I'd love to hear about your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't respond with medical advice, but what I can do is answer that question in a future video like I did here. Make sure to subscribe to my channel. You can be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.